Welcome back in another discussion of INDEX-TB guidelines. In this discussion, we will discuss about recommendation for the use of CBNet or GeneXpert in the EPTB diagnosis, and also we'll discuss a little bit about the recommendation for the duration of treatment in EPTB, how long we should treat the patient having extrapulmonary tuberculosis. Welcome back, and let's start. Let's have some discussion about the recommendation for the use of CBNet or GeneXpert in the EPTB diagnosis. So question arises, why to use GeneXpert or CBNet? Because we know that it has a good diagnostic accuracy, and number two is it can give idea about the rifampicin sensitive status. Okay, so here we can see in the lymph node samples, if you compare at the standard of culture, then sensitivity in the lymph node sample is 83%, its specificity is 94%. In the CSF samples, its sensitivity is 81%, and specificity you can see 98%. However, see here in the pleural fluid, it is have only 46% sensitivity. So it is said that it's better, we can avoid doing CBNet in pleural fluid, but still it's better to do a CBNet in the pleural fluid also, because in some situation in the 46% of the left out patient, we can detect the Mycobacterium tuberculosis gene and also the rifampicin status. So it's better to do CBNet in the pleural fluid also, although it has a low sensitivity. So what are the current recommendation? If you refer to the training module on the extrapulmonary tuberculosis 2023, this is just released and it is updated recommendation. We can get it downloaded from the TBC India website, or I will putting the link here in the description box, or you can see in the I button also. So what they recommend that in the lymph node TB, GeneXpert should be used as an additional test. It should be used an additional test apart from what we do. We do a conventional smear microscopy, we do a culture, we do a cytology in the FNSC smear. So we can use an additional test, but we can use as an additional test in the lymph node tuberculosis, but it's better to do a CBNet also in the lymph node specimen. Take out the sample, send the sample for FNSC cytology along with your CBNet and better AAB culture also, right? And in TB meningitis, expert may be used as an adjunctive test for TBM. So it is an adjunctive test, because a negative test of CBNet does not rule out tuberculosis, and decision to give ATT should be based on the clinical features and CSA profile. So in tubercular meningitis, we should do CBNet, GeneXpert, but decision to give ATT, decision to treat the patient depends solely on the clinical presentation and the CSA picture of that patient. Okay, we will discuss all these things one by one later in detail in our upcoming videos. And in pleural TB, GeneXpert should not be used to diagnose pleural TB. However, they say again because of the low sensitivity, but still in pleural tuberculosis also, in pleural fluid also, if the facility is there, we should always do a CBNet. Okay. Here there is a condition that AFB, GeneXpert, MGIT, liquid culture are not routinely recommended due to resource constraint and low sensitivity. However, where they are available, we should always consider them. So in pleural fluid, we should do a GeneXpert, and midget culture, AAB culture, that we can depending on the resource settings and as per the clinical condition, clinical profile of the patient. But by far now, pleural fluid, if you draw the sample for pleural fluid, you send CBNet along with all your necessary investigation, routine investigation that we do in the pleural fluid. All right. Now coming to the recommendation for the duration of treatment in EPTB, how long we should treat the patient having extrapulmonary tuberculosis. So this is updated now, and here we can see the list, entire list, that how long we should treat. So in ocular TB, here we can say 6 to 9 months. Regime is given in this part. So in the IP and CP, here we can see all the treatment duration, and it is also taken from your training module that is updated in 2023, available in a TBC India. So here the important point to know in this treatment duration is the patient who is tolerating all these first line drug. Here you can see, and his treatment duration, his treatment is going uneventful. For example, he is taking his anti-tubercular drug and he is tolerating very well. So this is the entire duration of treatment that we can offer to him. But in case the patient develops drug-induced hepatitis, or there is an intercurrent illness, because of that there is some interruptions or irregular in the treatment, and in some situation treatment is also modified. In those situations, obviously this duration will not be there. We have to extend that regime depending on the case-to-case basis. All right. So if this is the treatment duration in the extrapulmonary tuberculosis. All right. So this is all for today. In the next upcoming videos, we will take one by one topic and we will try to discuss the details of extrapulmonary tuberculosis depending on the site and depending on the system wise. So stay tuned, keep watching, and share among your friends, physicians, and clinicians also who are interested or who are treating with the tuberculosis patient. So stay tuned, keep watching, and thank you so much for watching. See you all in the next videos.